Diverticular disease refers to the presence of outpouchings, known as diverticular, formed in the large intestine. Diverticular disease presents in two ways: diverticulosis, which is the condition of having many diverticula. This is usually asymptomatic. However, diverticulosis can progress into diverticulitis, which is present if diverticula become inflamed and infected. So how are diverticula formed? In the large intestine, there are 4 layers: mucosa, submucosa, the muscular layer, and serosa. The motility of the bowel is reliant on the muscular layer and its contractions to propel fecal matter. In cases of chronic constipation, low fibre diets, and excessive wind, pressure increases in the bowel, and this, in association with straining to go to the bathroom over a prolonged period, causes weakening of the muscular layer. Diverticula form when the layers of mucosa and submucosa protrude through these weakened areas. Diverticulosis forms into diverticulitis when diverticula become infected and inflamed. This commonly occurs when diverticular pouches are blocked by stool, but can also occur due to tearing or, more seriously, rupture of the diverticula. Although it must be noted that diverticular disease is not fully understood, and it is believed that other factors play a role in the disease. These factors include a genetic predisposition, obesity, low fibre diets, and a sedentary lifestyle. So what are the symptoms? Diverticulosis is usually asymptomatic. However, there may be a presence of blood in stool if a blood vessel surrounds an outpouching. On the other hand, diverticulitis causes many symptoms, including lower abdominal pain, vomiting and nausea, abdominal tenderness, and constipation or diarrhea. Several other conditions can cause symptoms that are similar to diverticulitis. To rule out other conditions and check for signs of diverticulitis, your doctor might order 1 or more tests. Tests can include abdominal imaging, colonoscopies, stool tests, urine tests, and blood tests. So what can you do to manage diverticular disease? Increasing fibre and water intake can help bulk and soften stool, limiting constipation and straining, and therefore reducing the risk of more diverticula forming. In cases of diverticulitis, invasive treatments may be necessary to drain abscesses, mend perforations, or treat fistulas. Your doctor may also recommend a clear liquid diet and prescribe antibiotics for a short period of time in order to ease diverticular inflammation. If your symptoms persist, a surgical resection is a curative treatment option where part of the damaged bowel can be removed and rejoined or rerouted to an opening in the abdominal wall. For more information on any of these aspects of diverticular disease, have a look at these resources.